Hello, good morning. Hi. Welcome to the 2026 RCPA Capital Day. Thank you so much for coming, and thank all of you who are on the steps here today. Yes. It is important. It's important we come out in force today. I'm Richard Edley, President and CEO of RCPA. It's great to be here with you. As a quick reminder, RCPA, we now represent over 400 agencies and organizations throughout Pennsylvania in every district. So when you're out there today talking to legislators, make sure they know that. Make sure you have the power and strength of the 400 plus agencies behind you. And we'll be highlighting a lot of the different issues today. We have 9 divisions in Health and Human Services, so there's a lot to talk about. But clearly, across all of these divisions and all of these groups, whether it's mental health, substance use, physical disabilities, intellectual disabilities, brain injury, children and youth, what are we talking about? We're talking about funding. We're talking about workforce issues. And I know I see some t-shirts all about workforce. Talking about administrative burden and how legislators and the administration can help us. Now, we do have a very busy and packed agenda today. We have several legislators who offered some time here. They're on a very tight schedule. They're in session, they're voting, they're doing some things, and we're willing to jump out and join us. So I'll be very brief right now. I'll come back at the end, maybe wrap it up with a few thoughts. But because of the time, wanted to get right into the program. And first, before we get to the legislators and others, just a couple of words from the RCPA Board Chair, Carl Clark, President and CEO of Devereaux Advanced Behavioral Health. Carl.
Hey, good morning, everybody. It's a great opportunity to meet with legislators and share with them what's most coherent and important to our industry now at this very momentous time. And I look forward to, glad to see we have a good representation here from elected officials, and I look forward to interacting with some of you and making some positive change as we move forward. Thank you.
Thank you, Carl. Our first speaker is Representative Arvind Venkat, who's right here. And you may know that the representative is an emergency room physician and elected in November of 2022. Time flies. It's already been that many years. And he's the first Indian American to be elected to the State House and the first physician to serve in over 60 years. And so obviously, one of the issues that we've talked to the Representative Venkat about, obviously healthcare, and he's been very, very interested. Just this morning, talking to him about artificial intelligence and administrative burden, all sorts of things. And I will tell you that we have a very good, close working relationship with him, and are very happy and proud that he's here to share some time. One of the many who's on a very tight schedule. So, Representative Venkat.
Good morning. We can do better than that. Good morning. Hey. Thank you for being here. Thank you to Richard, and thank you to RCPA for the kind invitation. My name is Arvind Venkat. I'm the state representative for the 30th Legislative District, which is in the North Hills suburbs of Pittsburgh in Allegheny County. More importantly, I'm an ER doc. I still practice. And so the work of RCPA and the investments that we make to make your work move forward is critically important to me and my community. As an emergency physician, I recognize that when we do not invest in these resources and these programs, that the consequences show up in my emergency department. And today, when we are about to see, starting in January 2027, severe cuts to Medicaid, and already are seeing severe cuts to food assistance, this is going to be a danger for us in our Commonwealth. There's a saying that I think is particularly important here in this building, which is, show me your budget and I will show you your values. And where we invest is critically important. So my commitment, and I know I share that with bipartisan colleagues, is to make sure that in human services, in the areas that are so desperately needed for so many here in Pennsylvania, that we will continue to make those investments. None of that is easy, and your work today here in the state capitol to advocate with Republicans and Democrats to make sure they understand that this affects every single one of our communities is vitally important. So thank you for being here in Harrisburg today. Thank you for what you do every day and for making sure that we are visible on the needs of so many here in Pennsylvania and that those needs will be met in our budget and hopefully again at the federal level as well. So thank you very much.
Thank you, Representative Venkat. Just to highlight one of the things that he just said, he mentioned the terms, Republicans and Democrats. And one of the things you'll notice today is we have people from both sides of the aisle. And that's very intentional. And the reason is the issues we're talking about today, and as you go out and meet with legislators today, really don't have a partisan issue here. We're talking about benefits for people with disabilities and with illnesses. We're talking about health care and human services. This is not a partisan issue, and so remember that as you're there. Our next speaker, Eric Nelson, who's been in the House of Representatives since 2016. Now, a couple of years ago, for those of you who've come to our conference, we have an annual conference at the Hershey Lodge. A couple of years ago, we honored Representative Nelson with our Legislator of the Year award, and that's for a reason. You could not get a legislator who's more of a partner and working with us on issues, whether it's substance use, intellectual disabilities. This morning we were talking about administrative burden, and he works with appropriations, older adults, and so forth. And I could go on and on about his history. You can read about it, but just to know that, again, when we are looking for champions out there, there's a reason that we asked Representative Nelson to be here today. So with that.
Hello, RCPA. How are you guys doing today? Good. It is great to be here. And I know I just have a brief moment to share some remarks, but I wanted to start out with, I think, the most important message, and that is an extreme, sincere thank you to each of you, to the ones who were able to make it out here today and the ones who are still busy at home doing such important work for families. You are the backbone of Pennsylvania's most vulnerable citizens, and it's across a lot of areas: behavioral health, intellectual disability, substance use treatment, community-based supports. The work you do is essential. But let's be honest, it is not easy. You have a heart for it, a calling for it, and you're dealing with high rising demand, limited workforce abilities, and, as we were talking earlier, extreme administrative burden. I was listening to one of our providers in Westmoreland County today, and she was telling me of a recent inspection that they had to go through, hours and hours to prepare, 4 clients, 5-hour inspection for 2 people at the facility. And then next week, they'll receive an additional inspection. County, OLTL, ODP, CHC, an alphabet soup of documentation, again and again, looking at the same things and oftentimes at different times. And that burden draws you away from what you're caused to do. Every hour spent on unnecessary paperwork is an hour that you don't get to spend doing that vital work for families. And we want to be able to help. As Representative Venkat, the senators that are here, together in a bipartisan way, we want to help streamline your work. Still have that accountability, but allow us to help maybe navigate that better. So as you're meeting with representatives and senators today, please tell your stories. Be specific. Talk about duplication, redundancy, and ideas that we can help implement for you or work with the department to continue to streamline so that we all can focus on the work and the service and not necessarily too much of that paperwork. It's my honor to be here with each of you. It's my honor to be here for you guys. Thank you so much, RCPA, for spending your day here at the Capitol and helping to drive change in Pennsylvania. We need you. We appreciate you. Thank you very much.
So I mentioned earlier about the size of RCPA and why it's important to bring that up and to show our size and strength. And I've said this year after year that too often in human services, we lapse into sort of a one-down position. Please just don't cut us too much, or can you keep us flat funded, or can you just try not to hurt this area? And that's really the wrong attitude. As the representative just said, what all of you do is so important. We need to go in there with strength and talk about what we need. And a great point on his part about administrative efficiencies and redundancies. Those are easy. That's not, we want more money. Can you just make our life easier? And too often it becomes a soundbite. You hear people say, we need to focus on administrative efficiency, and then they go back to their office, we go to our office. What happened? So we need to not only talk about it and give examples, but then follow through. Now our next speaker, State Representative Ann Flood, who has assumed the House role in 2021, and she has worked very closely with us on a number of different healthcare issues, most recently really helping us with acquired and traumatic brain injury services. And for those of you who saw the budget hearings know that she was very passionate about it and asked a number of really good questions. And she too has been touched by this issue, which she may or may not talk about, but really helps us to understand, not that we all need personal stories, but it really does shed a little bit different light on it. I know I've been in that position and talked about it many times. Before I turn it over to Representative Flood, I also wanted to again thank everyone here. You don't realize what it's like to be up here. You know, everyone's staring, you got the cameras. It's nice to know you have my back, so thank you very much. And it began today with, I forget who, said, by the way, I like your tie. See, they really have my back. So with that, Representative Flood.
Good morning, everyone. It's such a pleasure to be here with you today. As he said, my name is Ann Flood. I represent the 138th District in Northampton County, and I'm so excited to be here with you today on Brain Injury Awareness Day, because it's just a really important day to really be out here and advocate. And what a wonderful sea of people that are here in support of all of this. So thank you all so much for being here. This day is dedicated to raising awareness about the challenges faced by individuals living with brain injuries and the importance of advocating for those needs. Brain injuries can affect people of all ages and backgrounds, and the impact extends far beyond the individual. It touches families, friends, and entire communities. Every story of resilience, struggle, and triumph reminds us why we are gathered here today. It is vital that we come together to support and uplift those affected, ensuring that they have access to resources, treatments, and understanding of their needs. As a co-chair of the Pennsylvania Brain Injury Caucus for the House of Representatives, alongside other members of the House and Senate to advance legislation that improves the lives of people living with brain injuries, today I want to highlight several critical issues affecting Pennsylvanians with brain injuries. The department, I have to go back a page. I skipped. My pages got stuck together. Through Pennsylvania Brain Injury Coalition, we unite individuals with brain injuries, their families, and organizations across the Commonwealth to advocate for meaningful change. The caucus focuses on strengthening rehabilitation access, supporting providers, and ensuring that every person living with a brain injury has a chance to recover, thrive, and live with dignity. One example of that work was House Bill 1442, known as the Morgan-Roses Law. This legislation improves how deaths caused by sudden unexpected death in epilepsy, or SUDEP, are identified and reported. It passed the House unanimously, reflecting broad bipartisan support. Accurate reporting allows us to track SUDEP in cases, which can provide essential data to guide research and prevention efforts and ultimately save lives. So we can get funding and we can study this. While we have made progress, significant challenges remain. Today, I want to highlight several critical issues affecting Pennsylvanians with brain injuries. The Department of Human Services Office of Long-Term Living released a home and community-based services rate and wage study in February of 2025. This study demonstrated the need for a 44% increase in residential habilitation rates, the primary service used to safely support individuals with brain injuries in their communities. These rates have not been increased by the state in over a decade, and the data informing this study is likely outdated, meaning what they actually need is going to be even greater. These challenges were reinforced during the recent budget hearings. As a member of the House Appropriations Committee, I recently participated in hearings with the Department of Human Services. Department of Human Services Secretary Dr. Valerie Arcouche and senior staff testified before the committee, and we discussed how to improve access to health care across Pennsylvania with a focus on services for individuals with brain injuries. The hearings highlighted the urgent need for updated residential habilitation rates and the ongoing challenges providers are facing in accepting new patients. While DHS noted that providers can request rate increases through Community Health Choices managed care organizations, we know that without legislative action, these increases are likely to be passed along. Although DHS reported that there is no official wait list for services, providers continue to experience difficulty accepting patients due to insufficient rates. Let me be clear, there absolutely is a wait list. Currently, there are 1,889 individuals with a brain injury enrolled with the CHC program, with roughly 240 receiving residential habilitation support. Needs vary. Some benefit most from residential care, while others rely on outpatient therapy or cognitive rehabilitation therapy, otherwise known as CRT, available at 90 locations statewide. They reinforce the urgent need for legislative and budgetary action to ensure individuals with brain injuries can receive the care and support they need to thrive. At the same time, access to specific therapies remain critical. Cognitive rehabilitation therapy is specialized treatment that helps individuals regain cognitive functions such as memory, attention, problem solving, and communication. For many, CRT is life-changing. It allows them to live more independently, return to work or school, and reconnect with loved ones. Ensuring coverage of these services is critical. Without it, many individuals cannot afford this vital therapy. Legislative action to guarantee access to CRT will provide the care and support that individuals with brain injuries need to thrive. On a personal note, as discussed earlier, brain injury awareness is very deeply important to me. My daughter Lauren was born with a severe brain injury resulting from a placental abruption back in 2003. This led to cerebral palsy, seizure disorder, global developmental delay, cortical blindness, and a long list of other diagnoses. In her short life, she faced enormous challenges, but her spirit taught us the power of love, hope, and resilience. Those lessons inspired me to start Lauren's Hope Foundation back in 2008 after she had passed away from a seizure from SUDEP. Through the foundation, we work to enhance the lives of children with brain injuries, and we offer support for their families, whether through funding therapies, providing specialized equipment, or connecting families with critical resources. This work is more than a mission. It is a passion driven by the memory of my daughter Lauren and the countless other families that we've had the privilege to help. There is nothing more fulfilling than seeing the positive impact that can change the lives of these children and their families. So as you can see, fighting for support and services for those living with brain injuries is very, very important to me. One of the unique challenges with brain injuries is that they are often invisible to others. Unlike a broken leg or visible injuries that affects of a brain injury may not be immediately apparent, making it harder for others to recognize and understand the struggles that individuals face. This is why awareness is so critical. We must ensure that people understand the challenges faced by individuals with brain injuries, even when those challenges are not immediately visible. As we gather here today, let's remember that each of us has the power to make a difference. Let us continue to advocate for better access for treatments, fair and sustainable funding for providers, and the support needed for those living with brain injuries. Together we can bring awareness, compassion, and meaningful change to this important cause. So thank you so much for your commitment and for being here today to help make a difference. Thank you.
I think you see why we have Representative Flood here today. She brought up a few interesting points that I just want to circle back on. One is she talked about some of the data, particularly with brain injury, and I wanted to remind everyone we do have a table over there with all sorts of handouts, including a one-pager about brain injury, so if you want to gather a few and take to some of your meetings. She also touched upon the wait list. Wait list is a very interesting topic, regardless of what system we're talking about, whether it's ODP, OLTL, or for that matter, even within behavioral health managed care. What often happens, or what we see happening, is people can get funding, actually. We could say, good news, here's your funding. But if you can't find a provider that has capacity to serve you, all we've done is taken you from that wait list and said we've solved the problem and we put you on that wait list. And that's happening in every system. And I think that's very important to remind legislators about. And we really can't let the administration off the hook. Whatever system it is, well, we're improving the wait list, or we really don't have a wait list. What does that mean? Because it doesn't quite mean what I think people think it means, which is we've solved the problem. The final thing is, Representative Flood talked about her personal story, and all of you being here today is important. I mentioned I have my own. I have a son with severe autism, many of you know, and I don't come to the Capitol and talk to legislators because I really have a need to talk about him, but I do think it's important that we aren't seen as sort of academic or intellectual. We have data, and this is about people and people's lives and families, and that's what we have to remind people of. Yes, we have the data, and that's important, but there's also, I think even as Representative Nelson said, getting across the stories are important as well. Our final legislator speaking today, and then we still have another surprise speaker at the end, but our final legislator is Senator Patty Kim. And I mentioned that the House is in session, so they're very pulled. Well, the Senate's not in session, so we're very, very happy that Senator Kim took time out of her schedule to come over to the Capitol. We've been working with her a number of years, including when she was in the House, and has really been another person who's been a great champion for quality health care and access and so forth. She works with appropriation, education, insurance, and so forth, and from right here in the Harrisburg and surrounding community area. So with that, Senator Kim.
Good morning, everyone. Again, my name is Patty Kim. You are in my district, so District 15. Welcome. For the people behind me, I've been on these stairs many, many times. If you feel dizzy, please sit down. If you need water, there's a water fountain, but please do not faint on these marble steps. We want to keep you safe. Thank you to RCPA. They do a tremendous job in representing the agencies and providers. I'm always learning something new. Thank you, Representative Flood, for your story. I did not know about Lauren, but those are the stories we need to hear so that we can be better advocates. I just want to let you know that I'm an ally, that whenever we see issues that will be helpful to you guys, I will be there for you. My daughter, I'm not going to explain, received one of your services, and I am forever grateful for the people who provided the services, the ease of it, and the availability. Everybody deserves that. Everybody deserves that. So I will continue to fight for your issues. I love how Richard said, we're not asking for more money, we're just asking to streamline things and make it easier for what you guys do, and you guys are the ones who do it best. Thank you for being here. We will continue to be supportive. Thank you, guys.
Okay. Our next speaker is Dr. Kyle Kopko, the Executive Director for the County Commissioners Association of Pennsylvania, CCAP, a role that you've had for a really long time, since August of 2025, I believe. And comes with a great background in terms of in political science, and has a PhD in political science, and Juris Doctorate certificate in intellectual property law, and I can go on and on. But the issue for us, as you know, you probably figured this out if you live in Pennsylvania, we're very much a county-based system, which means we have to work very closely with all the counties and county commissioners, administrators, and so forth through all of the work that we do. So it's wonderful that Kyle was willing to come out today to share some time with us and really support our efforts and our partnership.
Thank you so much, Richard. Thank you so much for the generous introduction. Good morning, everyone. It is so great to see everyone here. As Richard said, my name's Dr. Kyle Kopko, and I have the incredible privilege of serving as the Executive Director of the County Commissioners Association of Pennsylvania, also known as CCAP. For those of you who may not be familiar, CCAP is a nonprofit organization that fosters bipartisan cooperation to strengthen our counties and provide a wide range of services, including human services. This is actually our 140th anniversary. And I want to begin by really thanking RCPA and all of you for being here and highlighting the importance of human services. And also thanks to our legislators, our human services leaders, and advocates who are here at the Capitol today. As Richard alluded to, I wanted to speak about the importance of increasing awareness and understanding of Pennsylvania's county-based mental health systems in particular, and the critical roles that our counties and providers play in delivering those services to respond to growing demand. You know, this past year, CCAP identified continued support for mental health services as one of its top policy priorities for 2026. I want to provide a little bit of context here. So if we look back at the last fiscal year, 2024, 2025, counties and their providers served more than 700,000 residents across the Commonwealth for a wide range of mental health services. And that's up 2% over the previous fiscal year. This is not going away. Demand is steady. These services support the most vulnerable residents in our communities, including individuals experiencing serious mental health illness, individuals in crisis, and families who are just seeking support. And while there has been this sustained demand, Pennsylvania's mental health system has suffered from chronic underfunding for more than a decade, and that unfortunately has eroded the capability and capacity for care, leading to longer wait times, sometimes gaps in access, and increased strain on our emergency departments and public safety systems. And then compounding this, we also have workforce shortages that are not only affecting counties, but our providers as well. It makes it much more difficult to ensure timely access to care. Sometimes individuals and families are experiencing delays in seeking care, which could range from just a few days to even more than a half a year, unfortunately. Now, counties have been working hard in partnership with their providers to innovate and expand services, but the reality is that the system requires stronger and more consistent state investment to meet the growing needs of residents. And without that investment, service availability may decline, and counties will be forced to make difficult decisions just to maintain core services and keep the systems operational. And without those community-based services, more individuals will be drawn into emergency departments, they will have interactions with law enforcement entities, and ultimately the criminal justice system. None of this is efficient. None of this is how the system is supposed to work. This affects residents. It strains our counties. It strains our providers, and ultimately impacts the health and safety of communities across Pennsylvania. Now, mental health issues touch virtually every family and every person in our Commonwealth, whether it's an aging parent, a spouse, a child in need of support. Everyone in Pennsylvania should have access to timely and appropriate care. In closing, I just want to mention that adequate investment in our mental health services and our providers, our crisis centers, and other systems is not optional. It's essential. And without it, Pennsylvania risks becoming a fractured system where the burden of care shifts onto emergency rooms, jails, schools, and families. So investing in human services, investing in mental health services at the county level and with our providers will ensure that we are able to meet people where they are, no matter their age or status, and no matter the time of year, to ensure that everyone has the support they need before a crisis or need becomes a catastrophe. And thank you again to RCPA and all of you here for your great support, and I'll turn it back over to Richard. Thank you so much.
Now comes the part you were all waiting for. I get to talk for, I was thinking about an hour, if that's okay. Had a couple things I just wanted to wrap up with, but while CCAP and Kyle were just presenting, it does remind me about the importance of partnerships. And we are, I talk about RCPA's strength and size and diversity, and I'm very proud of that. And it gives us a lot of strength in the administration, the legislature, the governor's office. But we also partner with a lot of other associations and groups, and it becomes very important. So I did want to give a shout out in addition to CCAP. I know a lot of people here over there from PAR, one of the other associations in the state, and thank you for joining us for our rally here today. I see Diane Conway from MAX is here. We work with the Alliance in Philadelphia, TPA in Pittsburgh, the ARC of Pennsylvania, the Home Care Association. I could go through the Hospital Association, in all different coalitions on certain issues. And that gives us even that much more strength. And so, what are you going to hear today when you're out meeting with legislators? One of the first things you'll hear from almost everyone, especially if they're in appropriation, is, I want to hear what you have to say, but remember, we have no money. And that's the beginning point. We got no money. We can't fund anything. Now, what do you want to talk about? Well, that's a tough place to start. And so a lot of times, it gives me pause. So are we supposed to just give up? There's no money. This is a tough year. Well, we can't. It's too important. It's our job to say, okay, we get it. We get there's no money. We understand that there's going to be a big budget fight again. But this is why it's important, and for legislators to do the right thing. You got to find the money sometimes. And so I just want to remind everyone that sorry, I guess it's not this year, can't be our response. If we allow that to happen, what does happen if some of our systems aren't funded? Adults with mental health issues could end up in the correction system. Individuals with IDD, intellectual development disabilities, who need 24/7 care are home with their aging parents not receiving those services. We talked a lot about traumatic brain injury and brain injury services. Those individuals could end up inappropriately in nursing homes. What about children who are in need of early intervention and do not get that kind of start and the services they need when they're young? We can't let that happen. I can go on and on with examples throughout our systems. So today we have to remind the legislators, find the money. And as the legislators also pointed out, in addition, not in place of, but in addition, help us to streamline and reduce administrative burden. We should spend more time on services and less time, as Representative Nelson talked about, on all the paperwork, all the requirements, all the audits, and so forth. One other piece that to remind everyone of, we're here talking about the state budget, and that is important. And last year there was a budget impasse. We cannot allow that to happen again. That was incredibly bad for a number of agencies, and we lost some programs that just won't be coming back because they couldn't be funded. But what else is happening? Most of you know that there's a big federal overlay this year and last year that we really can't ignore, and that's H.R. 1, also known as BBB. Secretary Arkush of the Department of Human Services has publicly stated, including at the appropriations meetings, that if nothing changes, we have to find $20 billion, that's with a B, in savings from our programs. And about 350,000, and some people have a higher estimate, 350,000 people will lose their benefits. Now take a moment to think about that. We're talking about all sorts of things. Is anyone talking about that? $20 billion in cuts and 350,000 people losing benefits. We can't have that happen. We have to also make sure, however this H.R. 1 is implemented, that it's done well. There are other aspects to H.R. 1, including increased eligibility checks, including increased fraud, waste, and abuse checks. And I will tell you that increased eligibility, you'll also hear some people, including some of your agencies, saying, well, it all sounds pretty bad, but our population is exempt. That may be true in paper, but what happens if Department of Human Services and the governor's office puts out an implementation plan for HR 1 that so significantly impacts the agencies that we represent that individuals, no doubt, who are eligible and should be receiving services will lose their benefit. So what then happens? Providers don't get funded, people could lose services, and then the fight begins. Families desperately try to appeal, get them back on the rolls of Medicaid, and probably will succeed. But for 3, 6 months, whatever, the person is without benefits. That's the impact of HR 1 that could easily happen. So don't get lulled into, well, at least the people we represent aren't going to be touched by that. We're exempt. No one's exempt when something like this happens. The other thing about fraud, waste, and abuse, no one's going to argue against that. There should be no fraud in our system. There should be no waste. On the other hand, I have warned legislators, you're about to embark on programs that will spend millions of dollars to get thousands of dollars. And that's important to remember. And the vast majority of the kind of waste and fraud and all that kind of stuff that happens are minor errors that providers themselves recognize, self-report, and pay it back. So you could easily say the system is working. We don't need additional layers and money spent that could be going into services to oversee and audit providers yet again. So all these things you could touch upon with legislators today. And get out and remember the fight. For all these services. I'll also recognize Michael Donovan. I didn't see him from the Philadelphia Alliance. I mentioned about our partnerships before. Thank you all for coming out here today. Several years ago, I've talked about this before. Believe it or not, I had the opportunity to speak to a kindergarten class about what I do. You can imagine how well that went, explaining this. And I didn't know what else to say to them, so I kept saying, what we do is fight, and we never give up the fight. And I remember afterwards, this one kindergarten came up, very nicely dressed in a suit and tie, probably had no idea what I'd been talking about, but he looked at me and said, good luck with your fight. So I thought, all right, I got the message across. So with that, all of you, keep up the fight, and thank you so much for coming out today.